While healthcare falls under provincial jurisdiction, it still obviously plays a prominent role in the federal election, with each party releasing its own healthcare promises as part of their platforms. But talk of healthcare mandates during this election campaign have really taken a backseat to tariffs, affordability, many other issues as well. So why is that? Well, this morning we are joined by Dr. Joss Reimer, president of the Canadian Medical Association. Welcome to the show, doctor.
Well,
nice to have you in
person.
person.
Thank you so much for having me.
I want to walk through some of the campaign promises and to get your response to that. So let's start with the Liberals. The Liberals want to recognize foreign health care credentials so doctors from outside the country can practice here. Liberal leader Mark Carney also wants to spend $4 billion on upgrading health facilities, while also calling for a Canadian licensing program that would help doctors practice in other provinces. What are your thoughts on that?
Yeah, we saw a lot of good stuff in their platform. So like you mentioned, the credentialing, we know that there are doctors who are here in Canada working in jobs not related to healthcare, and that's frustrating for them, but it's frustrating for us too. We're short 23,000 family physicians in Canada. So when there's people here who could help out, we want to get them into the system. So we appreciated seeing opportunities like that. We also liked seeing the $4 billion commitment to infrastructure. Most healthcare infrastructure was built in the 1950s in this country. It's not ready for climate crises, and so we need to have some investments to go into those buildings to make sure they're ready for smoke events, for heat events, that they can protect the people who are trying to get health care within those buildings.
All right, so let's take a look at the Conservative promises, if we could, the Conservative promises. They want to create a cohesive licensing program that they say can add 15,000 doctors by the year 2030. If provinces opt into that program, they say nurses and doctors can practice in other provinces that have opted in. They also want to fast-track testing for foreign-trained nurses and doctors. Your thoughts on this plan?
Yeah, again, we know that there are more people who could be part of our healthcare system, and they want to be part of it. So the Blue Seal program that the Conservative has proposed, we would like to get doctors involved in that, because we know that when there's a doctor maybe living in Toronto, working in Toronto, but there's a community in northern Saskatchewan that needs help for the weekend, that maybe that Toronto doctor would be willing to go help out for the weekend if they didn't have to pay for a license, pay thousands of dollars, go through that application process. If it was easier, maybe we could have some better mobility and flexibility to address the needs that Canadians have across the country.
Let's look at the NDP's promises. The NDP's healthcare promises target having a doctor for every Canadian by the year 2030, plus a licensing program similar to the Conservatives and the Liberals. Party leader Jagmeet Singh also saying his party will create more medical residencies, invest in regional medical schools, and lower drug and dental costs. Your thoughts?
Well, when we're talking about being short 23,000 family physicians, and there's 6.5 million Canadians who don't have a family doctor, there's not one solution that's going to solve all of that. So we need to be having increasing in training spots, make use of all the physicians who are here, bring in U.S. physicians. We've got lots of attention from U.S. physicians wanting to come to Canada right now. So that's a market that we can use this window of opportunity, bring in team-based care so that it's not just physicians providing all the care, but there's nurses and dietitians and pharmacists working on the same team in the same place. I want to see all of these solutions coming in together, and that's where we like some of these platforms with multiple ideas.
Yeah, so okay, so there we sort of laid out some of the highlights. So when you're looking at the platforms, I'd love your opinion on what you feel is missing from what you're hearing.
You know, one of the big things that we're worried about in the healthcare system is misinformation. There's so much false information online right now. Canadians are really bombarded by it, especially on social media. I'd like to see some big commitments from federal governments to invest in fighting misinformation so that we can have trusted sources of information for Canadians, because we know that almost a quarter of Canadians have experienced a bad health outcome because they followed advice they saw online. So think about how that much is impacting our health system when people are having these bad health outcomes. And we need to improve access to care so that they're not relying on information they saw online.
All right. Well, Dr. Reimer, we appreciate your thoughts on all of these platforms. Thanks for coming in today.
Oh, it's great to talk about the election. Only a few more days to go.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.